Let's proceed to differential diagnosis in Western and Chinese medicine, and let's talk about depression. In Western differentiation, the causes of depression include: first, prolonged emotional strain. This includes disappointment, grief, sadness, childhood events such as abuse or neglect, and social isolation. Another cause is prolonged physical pain or having a major illness. This manifests with depression, fatigue, malaise, other symptoms according to physical cause of depression. Another cause is hypothyroidism. This will manifest with depression, with weakness, fatigue, cold intolerance, weight gain, joint or muscle pain, thin or brittle hair, brittle fingernails, and constipation. Another cause is addiction. It could be alcohol abuse, where there is depression with solitary drinking, making excuses to drink, lack of control over drinking, aggressive behavior, hostility if confronted with problems, neglect of food intake, neglect of physical appearance, shaking in the morning, and confusion. Or it could be drug abuse, where there is addicted to behavior patterns as in alcohol abuse, together with violent mood swings and unpredictable behavioral patterns. Another cause is chronic stress. There will be depression with muscle tension, headaches, sweating, dry mouth, difficulty swallowing, rapid or irregular heartbeat, diarrhea, frequent urination, irritability, poor concentration, and low libido. Another cause is nutritional deficiencies, such as folate and omega-3 fatty acids. And another cause is sleeping disorders. There is depression with problems falling or staying asleep, problems with staying awake, and irregular sleep patterns, sleep disruptive behaviors. Let's now go to Chinese differentiation of depression. Let's start with organ interrelationship. We can look into the kidney and liver and the heart and spleen relationships. These are the Shang cycle relationship or the generating pattern relationships. Another is the relationship between the pericardium and the heart. These are belong to Julian meridians. Another is the kidney and heart relationship, or the Kuhl cycle and the Shaoyin meridian relationship. Another is lung and heart relationship. This both involves the chest chi and as the relationship of the controlling or the Kuhl cycle. Another relationship we should look into is the lung-liver relationship. And these organs have the Kuhl cycle relationship. The heart or the Shaoyin and the gallbladder, the Shaoyang relationship. Next, we look into the type of depression. If there is sighing, moodiness, wound up, repressed anger, frustration, resentment, feeling of being trapped, inability to move forward or see the future, there's guilt and timidity. This indicates an imbalance of the wood element. If there is vexation, agitation, lack of joy, inability to communicate, hurt, rejection, defensiveness, these all are indicative of a disharmony of the fire. If there is oppression, anxiety, sorrow, grief, lack of self-worth, pointlessness, inability to let go, detachment, these are indicative of a disharmony of the metal element. Repetitive thinking, inability to resolve, worry, entrenched spite, insecurity, lack of support, this indicates a disharmony of the earth. Dread, fear, mental debility, feeling of being overwhelmed, feeling can't cope, phobias, and helplessness indicates a disharmony of the water element. Mental restlessness indicates iron deficiency, postnatal depression for both heart and gallbladder deficiency, and blood deficiency. Etiology is first due to diet, as like due to taking or consuming excessive damp and heat-producing foods causing fire and phlegm. A constitutional weakness, it could also be due to overwork, a taking of drugs which deplete yin and blood and disturb the shen. It could also be due to bereavement, shock, illness, life circumstances, and pain. Now let's go to Zhang Fu patterns. Here we have stagnation of liver qi, lungs not descending and diffusing, stagnation of heart Qi, heart and gallbladder Qi deficiency, heart liver blood stasis, heart liver blood deficiency, heart yin deficiency with empty heat, kidney yin deficiency with empty heat, liver yin deficiency with empty heat, and spleen and kidney yang deficiency. Thank you for your attention.